Hello there, my name is Micah, and I would like to talk about schizophrenia today. I have 5 topics related to schizophrenia. The topics are what schizophrenia is, how it affects one's memory, how it can be managed, different types of therapies that can be helpful, and the difference between mental health and mental illness. So, schizophrenia is a psychological disorder that affects the brain by changing its structure. It causes reduced gray matter and disrupted white matter. Some of the symptoms include visual and auditory hallucinations, disorganized and abnormal motor behavior, disorganized thought, and delusions. For example, hearing voices, seeing people or things that are not there, and not being able to keep track of time. Schizophrenia affects the person's memory as well. This is a core symptom of cognitive dysfunction. For example, remembering false memories vividly and still believing that they're happening in real life, even when on psychotherapy medications. A person with schizophrenia needs to be on antipsychotic medication. This is a chronic condition and it will need to be treated for the life of the individual. For the therapies that can be helpful for the symptoms of schizophrenia, there are a couple examples. Cognitive behavioral therapy is one, or CBT. CBT treatment focuses on changing negative patterns of thinking and behavior. CBT for schizophrenia typically involves identifying and overcoming delusional beliefs, developing strategies for coping with hallucinations, improving problem-solving skills, improving social function, and managing stress and anxiety to prevent relapse. The next one is cognitive remediation. It aims to improve cognitive function. This includes attention and concentration, memory, speed, and information processing. Even some talk therapies can be helpful. Group therapy and family therapies are examples of talk therapies that they could use. So now that I have explained the aspects of schizophrenia, let's talk about the difference between mental health versus mental illness. Mental health is a lifelong upkeep of our brains. Every person has mental health if they are cognizant beings. Doing things such as meditation, breathing exercises, and relaxing hobbies that we enjoy can help our daily mental health. Mental illness is any disorder that affects the brain, such as schizophrenia, depression, CPTSD, OCD, anxiety, and so on. These can be treated by mental health professionals such as a therapist or a psychologist, depending on the individual's personal needs. My sources are as follows, and thank you very much for listening. Have a great day.